Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Friday, April the 3rd. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the City's Emergency Operations Centre, Matthew Pegg. First up with remarks is Mayor Tory. Mr. Mayor.
Well, good afternoon. Today, the Government of Ontario released its COVID-19 projections. I support Premier Ford in making this information public so that everyone has all of the information they need in order to make the right decisions to protect their health, the health of their families, and the health of everybody who lives in this city. I know many people will be scared after seeing the Government of Ontario's modelling data on how many lives could be lost in our province due to COVID-19. When I saw some of this very same kind of information, I was scared. I'm not ashamed to say that. Who wouldn't be? These aren't just numbers, they are lives of real people, grandparents, great-grandparents, moms, dads, people just like those starting out their lives, children, God forbid, are involved in this. So they're all people that are potentially at risk here. It's beyond heartbreaking, but for me and for us, trying to provide the leadership that you would expect, it left me very firmly resolved. I was resolved in my determination to do as much as I could, working with the Medical Officer of Health and with the Chief and everybody else before I heard this information, but I was even more firmly resolved afterwards to adopt and implement and do it with as much determination as I could, the recommendations made by the Chief Medical Officer of Health. I'm more determined than ever now to do everything that I can as your mayor and to work with the wonderful team of public servants that we have to make sure that the city continues to make every possible effort as a municipality working with our partners to stop the spread of COVID-19. That's to protect the city. That's to save lives. That is our mandate, to do those things and to try at the same time, as you've heard, to protect the healthcare system and to protect the economy and our way of life. So I want people to know that we are doing everything we can as a city government to save lives and to get through this pandemic as soon as we possibly can. I want any parents having to talk to their kids about the sad news that we heard today to tell their kids that we are doing everything. We're all working together to do everything we possibly can to keep everyone safe. That is why we've taken action throughout this crisis and took even stronger action this week on the advice of our Medical Officer of Health, launching our up to 90-day battle to win this war against COVID-19. We want to make sure that we do everything we can as a municipal government to lock down this city to save lives. And that's why Toronto moved early to recommend the closing of restaurants and bars, to close city facilities and non-essential businesses, to declare an emergency so that we are ready to take immediate action to protect the city, to close playgrounds and other parks and the amenities in those parks, to cancel major parades and festivals for the next 3 months, to order residents with COVID-19 to quarantine for 14 days, along with those waiting for test results and those who have come into close contact with those diagnosed with COVID-19. And it's why we continue to urge our residents, perhaps most importantly of all, to stay home. That's why I approved yesterday the emergency order to reinforce physical distancing in parks and on squares, and that's why I'm announcing today that we have received approval to impose a $1,000 set fine for conviction under that bylaw, the maximum the courts could give us when we ask them for a set fine. And it's for anybody caught in a park or public square standing less than 2 meters from someone they don't live with. I was quite frankly disappointed to have to bring in a bylaw like this. Of the literally hundreds of emails that you're sending to me in my office each and every week, hundreds of emails I'm getting every week, your disappointment with those who haven't got the message on physical distancing is the #1 topic, because you're disappointed too in some of your fellow citizens. It's a minority, but nonetheless a significant enough number that we had to bring in a bylaw and that we have to talk about it almost each and every day. But I know that between common sense and enforcement, and people will be out there, as you'll hear from Chief Pegg in a moment or two, I know that between common sense and enforcement, you will do now what you have to do, and we will save lives as a result of that. I'm looking forward to better things this weekend. I can tell you that while we are laser focused on the health emergency, we're also focused on making sure we do everything we can to help residents and businesses now and in the future when we have beat this virus and we have to restart our economy. Many of you are very worried about your employment future, your financial future beyond, obviously, your very deep concern about everybody's health. Today, the city released an update on the financial impacts on the city of COVID-19. We believe it is important for the residents to have the same financial information that we have. This is, after all, your city, and it's your money. We're experiencing a financial pressure estimated at $65 million each and every week that this crisis goes on. This pressure is driven by things like reduced TTC revenues. Obviously, the TTC is not getting revenues for people who aren't riding on the transit system. And there are other decreased revenues as well, coupled with what you'd expect, some increased cost to make sure we support and look after people who need support. I'll give you another example. We've relaxed the parking regulations because more people are at home during the day, means fewer parking tickets are written. That money, again, goes into the city coffers to provide services that you rely upon. So I'll be working with the city staff. We are already with our city manager and with our budget chief, Councillor Gary Crawford, and we formed a group that is going to deal with these matters. But our focus is going to be on maintaining the services that you rely on and making sure that we won't be asking you to pay more money by proposing any kind of additional tax increases. We know that you're in no position through all of this to be looking at that as an option. I will be continuing the conversations I have been carrying on for a couple of weeks now with the Government of Canada and the Government of Ontario about how they can help, and indeed I would argue they must help, cities, not confined to the City of Toronto, but my job is to worry about you and about our city, to help the City of Toronto to get through this pandemic and to be ready to be rebuild and to restart as soon as this crisis has passed. We are doing everything we can at the City Hall to continue to deliver essential and critical services to our residents. But it is also critical that we focus laser-like, as I said, on making sure that the city's response is as effective and well-resourced and well-organized as it can be, and that is our focus. But we also have to make sure the economy emerges out of this as strong as it can be with a good, solid plan to make sure that we can restart it after things have returned to a more normal state. I can just tell you that we're in the middle again through a task force that I chair of developing those action plans so that we're ready to take full advantage of the opportunity that is Toronto. The city's on the front lines of this pandemic, and our residents are counting on us to deliver for them when it matters the most. And we are committed to helping many of the business sectors that are experiencing terrible pain right now to get through the crisis first and to emerge stronger out the other end. So the data released today makes it crystal clear that this is a deadly global virus. We are doing our best to deal with it, and we need each and every person in our city now to take action and to do their best to stop the spread. You know, it isn't something you ever think you're going to have to do as a mayor, to urge businesses to close rather than trying to encourage them to open, to have workers tape off playgrounds to keep people out of those playgrounds as opposed to building new ones so that people have more places to play. These are not the things that you ever contemplate doing, canceling parades instead of marching in them. But that's what we have to do, and if that is what we have to do in order to carry out the advice of our medical officer of health and other experts who tell us this is what we have to do to defeat this virus, then those are the things that have been done, and those are the things that will continue to be done. It's not easy for people. Their lives have been turned upside down by this in many different ways. It's tough medicine that we're being asked to take here, all of us together, but it's a deadly virus, and that requires tough medicine. I believe in Toronto residents and their ability to overcome almost anything. We've seen that with some of the tragedies that have happened in recent years and before that. And I know people will do the right thing, hopefully with even more resolve after the information they've received today, because it's really quite straightforward when you think about it. They've just got to follow the orders of our doctor. We are lucky to have a doctor who gives us those orders, that advice, those recommendations in a way that is entirely professional, entirely understood, and I just hope that we now follow those orders and stay safe and stay healthy, and I know that we'll emerge in the coming days stronger than ever. Thank you very much, and now I will ask Dr. Davila to address you for her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 1 o'clock this afternoon, there are 986 cases of COVID-19 in Toronto. This includes 812 confirmed cases and 174 probable cases. There are 89 cases in hospital and 42 in intensive care units. Approximately 27% of our cases are attributed to community spread, and there have been 13 COVID-19 deaths in total thus far. Again, I extend my sincerest condolences to the friends and families of all individuals who have died from COVID-19 in our community. Earlier today, as you've just heard, the province released COVID-19 modeling projections that stated that there would have been approximately 100,000 deaths over the course of the COVID-19 outbreak without public health measures. The province also said that if we do everything that we can, fully implementing all available tools and public health measures, especially those that maximize physical distancing, we may reduce this number to something in the range of 3,000 to 15,000 deaths in Ontario from COVID-19. Now, we know that Toronto is home to about 20% of the population of Ontario. So using the provincial numbers, we would roughly estimate that Toronto may see somewhere between 600 to 3,000 deaths by the end of this pandemic. I know these numbers are stark. Seeing what our future may look like based on these data is truly sobering and even frightening. But these are more than just numbers. They are our friends, our families, our neighbors, members of our community. They are our essential workers, our healthcare workers, and they are the people who work each and every day to help keep us safe. Most of all, these deaths are preventable. This is what keeps me up at night. We each have an opportunity and a personal responsibility to prevent this from happening. This is why everyone who can, everyone who is not an essential worker or a healthcare worker needs to stay home now. Everyone needs to be adhering to the public health measures put in place to save lives, to protect our healthcare system from being overwhelmed, and to restore our city. If we all do our part, if we all do as much as we can still reduce these numbers. If we take care of our city's most vulnerable residents, we can lower virus spread. I sincerely hope the starkness and the clarity of the provincial numbers will be a wake-up call to all of us, particularly to anyone who does not yet understand the gravity of our situation. Models help us to predict how diseases might spread, and they help us to predict the future course of an outbreak. They also help to inform our strategies to control outbreaks, to protect our community from virus spread. However, they are only as good as the information and the assumptions on which they're based. And with a new virus, like the one that causes COVID-19, information changes every single day as we learn more about this virus and how it spreads. Our models need to be adjusted to reflect what we are seeing in our community. My team at Toronto Public Health has reviewed available models, and what they consistently show us is that with the absence of a vaccine or effective treatments for COVID-19, we need to use other strategies to reduce the spread of the virus and to ensure that our healthcare system is not overwhelmed. These strategies include the strict physical distancing measures that we have put in place, as well as enhanced case and contact tracing and the use of self-isolation. While we use models to inform our thinking on the kinds of interventions we can use to control virus spread, they also help us to inform our thinking on how long these interventions and measures may need to be in place. We know that it takes time for our interventions to have an effect, And unfortunately, this will not happen overnight. So what do these modeling projections mean for Toronto? Well, we use these mathematical models together with our own city data and the experiences and data from other jurisdictions. When we put them all together, they give us the best possible picture of what our future could look like, especially if we do not act now. For anyone who has been watching the news on COVID-19, you know that countries like Spain and Italy have case counts over 100,000 and high fatality rates. In the case of Italy, the death rate is estimated to be more than 12%. What happens next here in Toronto? Our story here depends entirely on your actions, on our collective actions. It is important to share the starkness of this information with you so that you can understand why we must all get behind the physical distancing measures we have put in place. Most people want to do the right thing. I really believe that. But there are still hot spots in Toronto where people seem to be putting their own needs, their individual needs, before the needs of our community. They are still moving around the city and not practicing physical distancing. And from my perspective, as your medical officer of health, I find this deeply troubling. I do hope that today's information, the numbers that were provided today, will help these people understand the gravity of our situation. This is why it is so important for as many of us as possible to stay home. This is the only way we will reduce virus transmission in our community so that we can protect our city, so that we can minimize the loss of life, so that we can manage pressures on our healthcare system, and so that we can get our city back as soon as we can. This message is for each and every person in Toronto. If you do not keep your distance from others, if you cannot get behind these measures, you are putting at risk all of the people you care for, all of the people that we care for. The sooner everyone complies with these measures, and the better we can all comply with these measures, the sooner we can make it through this challenge together. Please, stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Excuse me. Thank you, Dr. Davila, and good afternoon. I will be brief today, reminding everyone of the plan to both educate the public and to enforce compliance with the orders and bylaws relating to both social and physical distancing. Our police and bylaw officers are engaged and are looking ahead to the upcoming weekend and beyond. As you know, Mayor Tory announced a bylaw yesterday that prohibits anyone who is not from the same household from being within 2 meters of one another in a park or a public space. The Toronto Police Service and the City are partnered on the enforcement of city bylaws and each of the orders, with 160 Toronto police officers and other personnel assigned to our COVID-19 enforcement team, in addition to 200 Toronto bylaw enforcement officers. The aim is to educate first about the seriousness of COVID-19 and about why these extraordinary measures are in place. However, if we do not see compliance, then fines can and will be issued, some of which carry very significant penalties. To date, almost 1,000 complaints have been made regarding parks amenities use and concerns from the public about inappropriate physical distancing. This figure is down slightly from yesterday, where numbers included complaints about open, non-essential businesses as well. For increased accuracy in reporting, we will separate these two items moving forward, and will share the data with respect to complaints about physical distancing concerns separately here. Toronto Police have issued 21 tickets to individuals to date. In case it is not already abundantly clear, we each have a personal responsibility to stay home so we can end the spread of COVID-19 as quickly as possible. The city is very serious about this. Lives literally depend on people understanding that they need to stay home to protect themselves and others. My responsibility is to ensure the city is able to continue to operate essential and critical services for the people of Toronto, and that the public servants charged with keeping the city safe have the tools they need to carry out their jobs, including having appropriate personal protective equipment. To that end, the city continues to deliver essential services, including emergency service by fire, police, and paramedic services. With respect to personal protective equipment, I would like to draw to your attention an error I made in my remarks yesterday with respect to PPE. In an attempt to be responsive to questions relating to the City of Toronto's PPE order that has been placed with the Government of Canada, of course via the Province of Ontario, I made an error in reporting the quantities that have been ordered in my formal remarks yesterday. In reporting the details of the various items that have been ordered, I incorrectly extrapolated box counts into individual item counts. This is an error on my part, and I apologize for that error. I will provide you with the correct quantities early next week. But to be clear, the order we have placed with the Government of Canada via the Province of Ontario is both accurate and correct. Again, my apologies. Finally, please continue to access toronto.ca/COVID-19 for information on COVID-19 and the city's response to the pandemic. Thank you.
Thank you, Chief Pegg. We'll go to questions now. And reminder, journalists, 2 questions, including a follow-up. Go to Matt Bingley from Global News.
My message is for the mayor. You said that $65 million are being lost per week. I've heard that there is a plan for all the non-essential city workers who have been sent home who have thus far not been laid off. I've heard that there is a plan to lay off some of them. I'm just wondering what you can tell me about that.
I can tell you that what we're working on right now is actually a plan to redeploy as many of them as possible, because what we found, of course, through a combination of increased need because of the strains put on the overall systems from A to Z by the virus, and secondly, the elevated level of illness that we have among our existing other staff members, that it is necessary for us to redeploy a large number of these people, and we're in the midst of determining which ones could be redeployed, how they could be retrained to do the jobs that they're required to do to help us out. And so we're focused on that entirely at the moment, and that is what we're going to be doing. And I suspect, based on progress to date, we're going to be able to redeploy quite a few of them, but we're working through that.
Can you tell me if there is a plan, though, to lay off some workers?
There is no plan at the moment to lay off anybody. There are just plans that we're executing, actually, to try and redeploy as many people as possible and to do the training that goes with that. And we'll see where that ends up and take it from there.
Thank you. We'll go to Beatrice from CP24 now.
Mr. Mayor, we've heard both yourself and Dr. Davila talking about a 90-day plan for the city and how we all have to do our part to not only flatten the curve, but chop the top of the curve off altogether. Today we hear from provincial officials that this could last 18 months to possibly 2 years. What's your message to the residents here, and how do you provide hope to people knowing they could live under these circumstances for up to 2 years?
Well, I'll start, and Dr. Davila can speak to the particulars of timing, but I will just say that what we were trying to do was to be honest with people about the duration of what I won't call the maximum period of time, but a minimum period of time that was based on professional advice, during which people should plan on adhering to the advice they've received about staying home and about businesses remaining closed and all the other things that have happened with events being canceled and the restrictions on how people interact with each other. And there was never any suggestion that that 90-day plan, or it was articulated earlier as 12 weeks, was necessarily going to be the time in which any particular result would be achieved. We just said we thought that if those measures were adhered to by people, that was a time in which we might see some flattening of the curve, as has been said. So I just want to be clear that both in speaking for myself, and the doctor will pick up with the professional expertise, that we want to get this over with as soon as possible. And I don't think anybody can give you a date, and the province was talking about later dates. We've always said if people didn't do the things that they're being asked to do, if we didn't get that kind of cooperation, and that was clearly one of the results we forecast, which was that it would last longer. So on that note, perhaps I'll ask the doctor to pick it up and talk about how we came to those time estimates.
Yes, thanks, Mayor Tory. So, in fact, what you heard the province talk about was the potential course of an outbreak extending as far as 18 months to 2 years. But you will also have heard that they talked about waves of the outbreak. So, in fact, you may see different waves of activity, and that's really what we're talking about here. There is a potential that, in fact, we see some activity now, as we have in our community. You can say late winter, spring, early spring, late spring, early summer. You may see some decrease in activity, and again, we're still learning about this virus. It's a new virus. But then we can expect that there may be, and again, no one really knows quite yet what will happen, this being a new virus. But I think that scientists understand that with these kinds of respiratory viruses, they often present in waves of illness, and they talk about the outbreak including multiple waves. Hence, you may see a timeline that stretches to 18 months and possibly up to 2 years.
And my follow-up, again, it could be go to either Dr. Davila or Mayor Tory. What is your red line when it comes to ordering a lockdown for the city? Certainly, Dr. Davila, we heard a desperate plea from you today asking for people to not be selfish, to take the lives of their loved ones and all of us into consideration. But at what point do you say enough is enough and order the city into a lockdown?
Well, in fact, I think, what we've tried to make clear over the past several briefings is that we've gone as far as we can. I know that, as much as there are powers under public health legislation, I can assure you I've exercised my powers as far as I can. I can let the mayor speak to his own powers under legislation. He does have a different set. However, I can assure you we have looked at all the options available and have tried to ensure that we are doing the very best we can on behalf of the people of Toronto, using our powers, using the authorities, using the tools that are available to us.
I will only add to that I think in this crisis from the beginning, it has been a combination of the powers, if you want to use that word, of all of the governments to do the maximum to try and bring this to an end as soon as possible, and most importantly of all, to save as many lives as possible. And I think there are things that we can continue to work on that are works in progress as we speak to make sure that we maximize the physical distancing and all the things you hear the doctor talk about. But I think most important of all continues to be the same thing. We are going to get the best results from people deciding 100%, not 92, not 86, not 41, that they're going to cooperate 100% with the measures that have already been recommended, the things that have already been ordered. If everybody got behind that, there's reasons to believe that we could get this over with sooner. But we will, of course, work as we are doing cooperatively with the other governments on all the different things that rest in front of us to try and make this come to an end as soon as possible and save as many lives as we possibly can.
Okay, we'll go to Jennifer Pagliaro from the Toronto Star.
Hi there. I'm not sure if the city manager is there, but if he is,
Jen.
I'd like to ask him a question.
Okay, yeah, he'll just switch out with Chief Pegg and be there in a moment.
Thank you.
Okay, go ahead, Jennifer.
Thanks so much. I just wanted to ask about the current interim plan to deal with the financial pressures. I know that you had spoken to council members about potentially using last year's surplus and also the capital from current, and I'm wondering if you could just maybe help me understand how you get through the next at least several weeks.
Right. Thanks very much, Jennifer. As noted, our pressure amounts to about $65 million a week, and our ability to kind of manage that is through the measures that you just pointed out. So there was certainly some surplus from 2019, and we have something called capital from current that we can utilize as well. But using that money will only last for a number of weeks. We believe by roughly June, we'll have expended those dollars, and then we'll be faced with the remainder of the pressure. So in that pressure, what's driving it is lost revenues. So, we expect that, we're going to see revenues from a number of different sources, plus, and rightfully so, we did defer some taxes for a 60-day period. So when you look at all of that, it starts to put pressure on our ability to stay liquid, as we call it. So that's where we're at, and obviously we're going to be in discussions with upper levels of government about how it is that we might be able to remedy that. But we will make sure that council is kept apprised of all of our strategies as the days and weeks move forward.
And I just wanted to ask Dr. Davila, I saw that the number of deaths has now increased. I know that there's still investigations underway, but I wonder if you could just give us any sense of who these people were, even aggregate data you might have about how old they are or what jobs they do.
Well, for today, unfortunately, Jennifer, I can't. And I am, I limit the amount of personal details we give in respect of these individual cases. I can try to put together some information so that there is an understanding on our community, or of our community, as to what's happening with respect to these deaths. But, every one of these is tragic. And I think we just need to stay laser focused on our mission to save as many lives as we can, to reduce the loss of life in this outbreak. Hence, physical distancing. I encourage every resident in our city to get behind that. But I shall share further details once we get through more investigations and have some information that we can provide to the city.
Okay, we'll go now to Francine Copeland from the Toronto Star. Francine?
Oh, hi. My first question is for Eileen, Dr. Davila. I'm sorry, I'm going to ask you to repeat something you said earlier. Based on the modeling that we saw from the province earlier today, what did you say the range of deaths could be in Toronto?
So for Toronto being 20% of the population of Ontario, if we take the provincial figures, we would expect and extrapolate them down to the city of Toronto, we may see somewhere between 600 and 3,000 deaths in the city by the end of the pandemic.
Thank you.
You're welcome.
Did you have a follow-up, Francine?
No, I have a different question. Do you want me to
okay,
wait,
go
or
ahead.
can I ask it now?
Yes,
okay.
go ahead.
So I have another question, and this one is for Chief Pegg. Bylaw officers are now out with police officers enforcing social distancing regulations. The information that you collect when you give somebody a ticket for not abiding by the social distancing rules, how is that information going to be handled? Are you keeping it separate from Toronto Police data, or is it going into Toronto Police databases?
Yeah, thanks for the question. And to be very candid, I'm going to need to defer that for a conversation with both municipal licensing and Toronto Police. I'm reluctant to try and give you that answer until I know specifically, so I will endeavor to get that back to you.
Okay, thank you.
Okay, thank you. Go now to Mark McAllister from City News. Go ahead, Mark.
Mayor Tory, if you would, if you can speak to just the cancellation of some of the recreation programs in the near future and the impact that may have, in addition to everything that has already taken place, to families and children in the city.
Well, first of all, I deeply regret the fact that we have to cancel these programs, but obviously if one of our concerns has been with respect to schools being open or closed as decided by the province and generally people being together, it's not consistent to have those programs proceed for the spring, and there are spring programs that had to do with recreation and the arts. Having canceled the programs, which affect a very large number of people, about 59,000 individual people that were signed up in these programs, children mostly will be affected by them, but not confined to children. We will now keep our fingers crossed that we'll be in a position to offer the summer programs that are relied upon by so many kids and by their families, and of course they provide employment for a lot of people who rely on that employment year in and year out. So it's just another of the tragic byproducts of this virus, but consistent with what we've been told we have to do to distance ourselves from one another and not be in groups. These programs fell victim to that, and we hope that that contributes to saving lives and also to brighter days ahead when we can hopefully proceed with our summer programs, but we'll have to see.
And Chief Pegg, if you would, there's only so many things in the purview of the municipality that can be done. There has been some questions that have been raised about ticketing people and offering the fines and the different amounts those fines could potentially be. Given the state of our economy right now, some people are raising the question, well, you can fine people all you want, they're not going to be able to pay them. So is there anything beyond ticketing that can be done?
Yeah, thank you for that question. And I think you hit the nail on the head, and you've heard us say from the start, our first priority in everything we do with respect to enforcement is education. And that is why every one of our staff and the Toronto Police staff that are involved in the enforcement team who are out in our parks and in our city facilities, the very first thing that they are doing and will continue to do is to educate, to make sure that people understand the significance and the rationale as to why these restrictions are in place, and literally to explain that people's lives depend on the actions that are being taken. So our first and foremost, it is about education. We will only resort to enforcement and tickets and fines if there is no other reasonable alternative. And I can assure you from the conversations that happen in the Emergency Operations Center to the conversations happening on that team, those are decisions that are made carefully. They are made reasonably, and certainly a balanced approach. But I'll go back to where you started. The first priority is education. I think Mayor Tory said it this morning. Our hope, we would like to see no tickets be necessary. And frankly, if people simply adhere to the rules and they do it for all of the reasons about saving lives, we won't need to issue a single ticket. The ticket is tickets and fines are literally a measure of last resort.
Okay, thank you. We'll go to John Yeager from Now Magazine. John?
Question would be for Dr. Davila. You said that there are hotspots where people are putting their individual needs ahead of the needs of the community. And I'm just wondering if you can comment on where those hotspots are, why you think the message isn't getting through there to those people or to those communities, and what you might be doing to get the message through to them.
Well, I don't know that I can speak to every hotspot. I mentioned some in my remarks yesterday. I know that there were issues at Sunnyside Park. I know that there have been neighborhoods throughout the city where there have been impromptu street parties and gatherings of the children on the street and parents socializing with each other. And they are scattered around the city, unfortunately. So what might we do? What can we do to try to get the message through? Well, I'm hoping that providing the starkness of the numbers, the provincial projections that have been provided, and the extrapolation, the understanding that, look, if those are the numbers at the provincial level, and Toronto is 20% of the provincial population, that we may see as many as somewhere between 600 and 3,000 deaths in our city as a result of COVID-19. I'm hoping that that makes it patently clear to the people of Toronto why it is we're asking them to take on things like physical distancing and staying home as much as possible. Again, we know that the more we get behind these, the more we get behind these measures, the more we do the right thing, the sooner we can bring this to an end, and the more we can save lives, the more we can preserve our healthcare system, and the less we can make the economic and social disruption, and the sooner we get our city back.
Follow-up, John?
No, I have another question, but I can ask that now or later.
Yeah, no, go ahead.
It would be for the mayor, I think. Be best addressed by the mayor. I'm wondering at all if you're concerned with the weather about to get warmer outside, which normally lures people out and could create unintentional crowds. What additional contingency measures you might consider other than a full lockdown if increased enforcement is not effective? So, for example, would the city consider restrictions on the entry of people into parks or a total ban on parks altogether?
We discussed that earlier on, and of course there are some practical issues with trying to close down the parks, aside from the real lack of desire to do that, because people can use the parks. But look, I've got a 3-for-1 deal that we can offer people here. They can save money and not pay a fine. They can save lives, which is even more important than saving money even when they're struggling. And they can get this crisis over with faster if they just follow a simple approach which also addresses what's going on in the parks. Stay home. Please stay home. You know, we've been asking people that for days and weeks. We have our professional doctor who advises all of us on this. We couldn't make it any clearer. And so the parks will be what the parks are, and look, if there are other measures that we can take, we're somewhat limited, then we'll have to take a look at them. But I'm an optimist about this weekend. I think the numbers put out today, I think the clarity of the message that we've been putting forward, I think the understanding that people have that they can, they can make a contribution to this being over with and to saving lives will cause there to be good compliance this weekend. There's always going to be a few, and that hopefully if some of them do get a ticket or get fined or even just get educated by our police and bylaw officers, I think their very presence will cause people to change their behavior. So there are no other current plans to do other things. I hope they're not necessary. I hope we don't even have to issue any tickets because people behave so well this weekend in the interest of their own city.
All right, that concludes today's briefing. Thank you very much. Have a safe weekend, everybody. We'll see you on Monday.